Why is an adductor strain or groin pull so detrimental to athletes? Hi, I'm Dr. Justin Lin, sports physical therapist at Rehab and Revive. Let's get to the answers shortly. But first, if you found this video helpful, please spend a few seconds to like it, subscribe to our channel. If it's really helped, consider tapping the thanks button and donating. Also, our team has been hard at work bringing you online exercise programs. You'll find the link to our Revive at Home programs in the descriptions box. We appreciate your support. Here's why this matters. Athletes rely on rapid, forceful movements, pushing off, cutting, accelerating, decelerating, pivoting. The adductor group is one of the key players in all of that. It doesn't simply bring your leg in, it stabilizes the pelvis, controls side-to-side forces, absorbs eccentric loads, and helps transfer power from the ground up. When those muscles are neglected, if they're weak, fatigued, or don't have adequate flexibility, they become vulnerable. A sudden change of direction or a lengthening under load can place enormous stress at the muscle-tendon junction. In the case of the adductors, that's often where the injury happens. What that means for you as an athlete, a groin or adductor pull isn't just, ouch, I pulled something. It can sideline you, disrupt training, raise the risk of recurrence, and degrade your performance if you return too early or without full rehab. So yes, stretching, strengthening, and maintaining the adductor complex is not optional. It's essential. You can use this stretch to help prevent injury or support recovery. Here's how. Stand with your feet wide, about hip width or a little wider, so you have access to the inner thigh. Put gentle pressure through your hip capsule. In other words, get grounded. Feel your hip bone to ensure the joint is stable. Then bend the opposite knee to the leg you are stretching. For example, if you're stretching your right inner thigh, bend your left knee. Then lean your torso slightly away from the leg you're stretching, so you'll feel a stretch through the inner thigh of the straight leg. In this example, your right leg. Ease into it gently. You should feel a moderate, controllable stretch, not pain. Maintain the position for about 30 to 45 seconds, breathing steadily. Then relax and repeat 2 to 3 times per side. For athletes doing high load work, you might integrate this preseason and postseason. And we're back. Here's an added tip for many of you. Combine this stretch with adductor strengthening, especially eccentric control, and hip abductor glute activation. You can check those out in our YouTube channel. Why? Because one of the risk factors for adductor strain is imbalance. Weak adductors, fatigue, decreased mobility, or inadequate preload preparation. Let us know your thoughts on this video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lim. Remember, we heal smarter,